scan. And we will talk inshallah about the introduction, renal anatomy and physiology, general view, and radiopharmaceutical used in renal scintigraphy, with the type of renal scintigraphy. Okay, we will include inshallah indications based patient preparations, radiopharmaceutical doses, and image as well. Okay, kidney, I think all of you knows the kidneys. We are using the radiopharmaceutical to scanning the kidneys disease. Okay, some disease kidneys. The necromancer help to find out the anatomy and to find out the disease of the kidney, especially the function of the necromancer of the kidneys. It's mainly the golden standard test to know the exact function of kidneys is in necromancer. Okay, first of all, we will talk about renal anatomy, the structure of kidney or the urinary system. Urinary system consists of two kidneys and ureters and bladder and urethra. Kidneys are reddish, long, bean-shaped organs located in posterior abdominal wall on each side of vertebral column, right and left vertebrae, behind the peritoneum and below the diaphragm. The right kidney is slightly lower than the left because of the liver pushing the kidneys a little bit lower. Okay, this is the anatomy of the kidney, and this is the lingual section. Okay, we can see here the cortex or قشرة الكلية, then the medulla, okay, and the renal bulbus. This is the main structure of kidneys. Okay, kidneys has, as we said, thin outer area called cortex, and thicker area, inner area, sorry, called medulla. Nephron is the unit or the functional unit of the kidneys, located mainly in cortex, and part of nephron located in middle. طبعا النفرون اللي هو المكون للكلية، مكون أساسي اللي من خلاله تتم عملية فلترة الدم, consists of glomerular and renal tubule. Okay. Renal tubule, we have three types of renal tubules in the nephron: proximal tubule, then lobe of Hilli, then the distal tubule. Nephron has three functions: filtering the blood plasma biglomerally, then reabsorption by tubule of material from the glomerular filter, and those material needed by body, then secretion of certain material by the tubules. So nephron will filter first in the glomerular or we call it Bowman's capsule. يفلتر كل شيء، يبقى بس الدم صافي بعد ما يدخل الدم للجلوميرولار. ثم يعاد او ري ابزوربشن تسمى، لان بعد ما يطلع الشعيرات الدمويه من البومنز كبسول تلتف حول التيبيولز بروكسيمال والديستال وكذلك اللوب فيلي. فالبروكسيمال والديستال ايضا، لكن mainly in proximal the nephron will give back all material needed back to the blood. Then السكريشن اللي هو last function اللي هو الماتيريال اللي to be يعني ejected out. This is the diagram of nephron. Okay, Bowman's capsule, proximal, tubule, then lobophilia. Lobophilia we have descending and ascending. Then the distal tubule and distal tubule وproximal tubule هذول في والبومانز كبسول او الجلوميرر موجوده في الكورتكس. اللوبوفيلي في الميدل. Then to the collecting duct, and collecting duct collecting from all nephrons to the pelvis, renal pelvis. And here, okay, here we call this an afferent arterioles, الشعيرات الدموية اللي داخلة، ثم efferent arterioles الخارجة من البومانز كبسول. بعدها as you see here it's make or made a nets to around the proximal and distal tubule. And سبحان الله يعني عجيب النفرون. طبعا هنا في الجلوميرس او البومانز كبسول blood will be filtered by all plasma will be filtered except the blood. Then it will give back whatever the body needs, and the lobophilia will adjust the pH and water and potassium as well with the sodium. والexcessive سواء من water or whatever any material will be يعني ejected out. Okay. Urine formed by kidneys, as we know, stored in the bladder, then finally discharged through the urethra to outside. Blood supplies is maintained by the renal artery. Either supplied from the aorta directly from the abdominal aorta. Kidneys receive 25% of cardiac output from each cardiac output. So any cycle of the cardiac, the kidney will receive 25% from whole volume of the blood. 25% من كل نبضة من القلب 25% تروح للكلى. Okay, the total volume passes through the kidneys in 3 to 5 minutes. This is the normal range. 20% of renal plasma flow filtered biglomerally, and it's about 120 ml per minute. مثل ما قلنا الكدنيز function regulate composition of blood and remove waste from blood in the form of urine, and this is the final product. Balance the water and electrolytes in the blood, help to regulate blood pressure by secreting enzyme renin, contribute to metabolism by synthesizing of a new glucose, and participating in synthesizing of vitamin D. Glomeruli filtered about 180 liters of plasma per day, for which 2 liters appears as urine in normal adult per day. Protein and organic compounds are not filtered. Okay, we will come to nuclear medicine. The radiopharmaceutical used in renal, it's the DTPA and MAG3 and iodine 123 OIH. The DTPA, it's totally glomerular filtration agent, will not be filtered in the tubules like in MAGA-3, we will come with. Reached at the peak of at 3 to 4 minutes after injection. Peaks means the maximum uptake for each kidney will reach at 4 minutes after injection. Good agent to demonstrating lesions with kidney because it's rapid clearance. Good for demonstrating obstruction of collecting system. لكن الماجا-3 better than DTPA to demonstrating obstruction. MAGA-3 is excellent imaging property and lower total body radiation because the 80% from the MAGA-3 will be absorbed in tubule. So the clearance will be rapid than DTPA. That's why the radiation will be low to the patients. So with normal patients, the first 20 minutes after injection, the patients will be free from radiation, mainly. DMSA cleared slowly from blood, concentration in the cortex at 4 to, or less than 4 to 6 hours after injection. طبعا high radiation dose to the patients because it will bound to the tubules and stuck there until the decay happens. So once you inject the patients with, let's say, 4 millicurie, 30 to 40% will stuck in the cortex of the kidney. The rest will be cleared or washed out through the urinary system. And what's bound to the cortex will stay there until the decay happens, so that's why it's more radiation than DTPA or MAGA-3. Pre-titrate may use to evaluate the blood flow. Okay, this is the 4th radiopharmaceutical use, and they are rare using this type of radioactive, and actually this is cleared from blood less than DTPA or MAGA-3, about 5%, because it's rapid filtered by 20% from the dose will be filtered by glomerular, and the rest will be filtered by tubules. And the main use is to determine the effective. Okay, DTPA, as we said, the 20% will be filtered within each cycle, and the MAGA-3, 40 to 50% will be filtered in each cycle, and either in 131 or 123, now are using 123, 100% the clearance or the filter by each cycle. So each cycle the kidney will clear the blood from the dose or this type of radiopharmacy. Okay. We have 3 types of scanning or reason to scan the renal. First of all, function and perfusion scan, captopril scan, and cortical scan. The indication is to analyzing renal function and perfusion, determine the glomerular filtration rate, GFR, to evaluate the renal fraction obstruction, hydronephrosis or hydroureter, even for renal transplant, to evaluate that kidney or the transplanted kidney is working well or not. And the preparation is, patient should be well hydrated before we study the scan. He must drink at least 3 to 4 liters before the injection, especially the 30 to 60 minutes period study. He must drink. And before we start, we ask the patients to avoid to prevent any inconvenience to the patient. طبعا with using the iodine, we have to give the patients local solution, and the main reason to use this type of solution to block thyroid, because the iodine will absorb by thyroid gland. So to block this, we're giving the patients local solution 2 days in advance. Doses. DTPA and MAG3, we give the patient 10 millicurie, and iodine heparin 3 millicurie maximum for adult. Pediatric is dependent on her weight or her weight. طبعا type of administration here is IV bolus injection without any flushing, or we are giving a saline after the injection, just to make sure and what is in the tube will goes inside. Okay, scanning. I think all of you know how to scan ready for the renal scan. The camera, we are using one camera on head in posterior view, matrix 128 multiply 128 matrix of MAG3 and even DTPA. With iodine, we are using 64 because we are giving patients less dose. So then we will inject the patients. As we said, bolus injection acquisition should start immediately. We are acquiring the flow or dynamic flow study using 2 seconds frames for 30 frames. The total will be 1 minute. Then immediate, we start the function, or we call excretion phase. Immediate after the flow end, 30 seconds per frames for 60 frames. The total will be 30 minutes in total. And actually it's depend. Some books said less seconds, 15 seconds or whatever per frame, and even the total time, it's different from book to book, but this is the main and mostly used here in Saudi Arabia. So we are scan them 30 seconds per frame for 60 frames. The total will be 30 minutes. Then if this function phase finish, start for 1 minute, we call it pre-void image. Then we ask the patient to go to the bathroom for voiding. Then we will be back, we scan them for pre, or we call it post for void image. If we're not using the Lasix, we will scan the patients 1 hour to 3 hours, depend on the initial image. If the filtration is good and the patients reach the peak and filtered within the time, so no need to scan the patients 3 hours or 1 hour later. If there is still collecting or still the kidney is not clear the activity, no, we should scan the patients after 1 hour. If we are using Lasix or any diuretic agent, no, we don't need the delay scan. And Lasix, it depends from physician to other. Some of them ask to give the diuretic agent 15 minutes before the injection. Some of them 0 minute, some plus 15 minutes after the injection. So it's depend from center to other, but usually to encourage the kidney to filter the radioactive material, and we will get an impression if the kidney, if there is an obstruction or not, if it's working or not. And this is the dose of diuretic or furosemide medication, 1 milligram per kg up to 20. For pediatric, it's depending on the weight. 5, we will give them 5 milligram, and so on. For adults, okay, we will stop at 20 milligram. For special cases, we may increase to 40 milligram. Injection should be slowly, infusion over 1 minute, and especially the first second from the injection, we have to monitor the patients because the vasodilatation may happen and the hypertension. Patients will become faint or so be careful. And any medication used in nuclear medicine, we have to have the authority from the doctor and should be given by nurse, by the way. And the nuclear medicine physician should be aware we are giving the patients this type of medication. If we inject the patients 15 minutes before and the scan delay for any reason, they say this type of injection will be valid for 25 minutes, then we will inject again the other dose. But it's dependent. Okay, as we said, we have the vascular phase, then parenchymal phase, and then wash-up, or we call it the excretion phase. Okay, this is the flow. 5 seconds per frame in this image. And by the way, we can image the patients whatever, 1 second, 2 seconds, and then here we sum it or gather more than frame to be 1 frame. So here we see this is the injection before, and the kidneys start collecting. Uptake is started from the first seconds of the injection. This is the function phase. Okay, now we see 3 minutes, the kidneys reach the peak, and after the 3 minutes or when 4 minutes started, the kidneys start excretion. So now you see the ureter and the bladder start increasing activity, and the activity in the kidneys start to become faint, and the excretion goes well. This kidneys are normal. And by the way, each frame it's 3 minutes. So this is the first 3 minutes, 6 minutes, whatever. So started excretion at the 4th minutes after injection. Then we will draw for each kidney. This is the flow phase, by the way, and we see both kidneys start getting activity. Okay, this is the function. We will see here the peak reach at about 3 to 4 minutes. Okay, then the excretion will start it. Here, at the 15 minutes, we give the patients the Lasix, and you see here the drop. It's because the diuretic injection. Without the Lasix, we may see the curve goes in this way, but it's still normal. With Lasix, no, we now know the kidneys are working very well, no obstruction. Okay, there is something called the half time. This is the time when the kidneys excrete half of uptake, and it should be between 8 to 12 or less than 8, 7 to 12 minutes. And in this range, the kidneys are normal. The function of the kidney is normal. More than this, no, we may we have the impression of disease or obstruction. Okay. Before that, before we go into this captopril, the renal transplant is the same what we're doing in the MAG3. We just scan the patients with both heads, anterior and posterior. And the kidneys with a kidney or transplanted kidney not will be in the abdomen, it will be in the pelvis. So we have to know that. Okay, cartoprel is the same mag-3 or dynamic renal scan, but we are giving the patients an cartoprel medication just to rule out if the patient has renal artery stenosis or not. Okay, we scan the patients without captopril, then we ask the patient. We will scan the patient other day with captopril, mag-3 or DTPA in normal way, as we said before. Then we ask the patient to be back. We give him a captopril 1 hour before. Then we scan. We give him the radioactive dose. Then scan as usual. Then the doctors will compare. If there is a difference between image with or without captopril, that means there is a renal stenosis. Usually, with captopril, we will not. The kidney will not reach the peak because the blood volume are less. This is the way what the kidney do action in artery with the stenosis. The volume will be less, then the kidney start or the kidney will secrete or give tubers renin, okay, in the bloodstream. Then this renin, after many actions, it will cause arterial constrictions that cause high pressure until the kidney reach the normal plasma flow. Okay, this is without captopril, regular renal scan, and this with captopril. See the right kidney, sorry, the left kidney, okay? Here are normal both, but here no, one of kidney is still uptake is going, and the right one is take the uptake, then release it. Okay, now the cortical renal scan, or we call it the static whatever. We are here scanning the cortex of the kidney. The indication may we will see the hydronephrosis, cyst, tumor, or trauma, infarction, or any congenital anomaly. Deprivation as well. Patients need to be well hydrated. The bladder should be emptied immediately before the scan. The dose of DMSA, it's about 5 millicurie for adults, and for pediatrics depending on the weight. The administration is IV, regular injection, and we can in DMSA do flushing or washing out the syringe to sure the dose will given to the patients. All those will be given to the patients. The acquisition mode is low energy, general purpose, or pinhole, depends. For patients pediatric, we can use the pinhole, or if we are going to see any small lesion or whatever. Technician, by the way, we are using with the DMSA, so the energy window will be 140 kilovolt with 20% of window. Patients is injected now, then the scanning will be 2 to 4 hours, and we can use 24 hours post-injection scan, depending on the patients, especially with those who has renal failure. We will scan him after 24 hours. The scanning will be anterior and posterior, left posterior oblique and right posterior oblique as well. SPECT may need it. And this is the image of DMSA. Here the right kidney atrophy, the left one are okay.
very good presentation.
Thanks. Any question?
But I will attend before the FARSIAR, final FARSIAR, biggest sitting inshallah. What do you advise for me to attend and interview in a nuclear case like that? Give me advice. And many times I will try to study like these images, but also interpretation I had reflect.
You have to have an experience. I mean, to see a lot of images with the nuclear physician. Many images, okay, scans, and see the goes to the box internet. Then we will be expert. And
Yeah, but sometimes I see some images like ghost, and when I look for image and description different.
Okay.
I'm how to compare between description
Well,
and
it's
image.
difficult. It's depend on each image.
That's why it's a nuclear medicine.
Yeah.
Because if you change the first two letters, will be a nuclear medicine.
And clear.
Yeah.